It has been well documented that the management of glycemia and cardiometabolic risk factors, supply of necessary medications, and reduction of acute and chronic consequences can all help people with diabetes to have improved quality of life and to live longer. However, in humanitarian crisis settings, as you know, there can be unique challenges that constitute a particular threat to people with diabetes, including in youth. Data relating to the outcomes of youth with type 1 diabetes within and from humanitarian crisis settings are unclear. With this all in mind, we conducted a quantitative narrative review using a systematic process. A comprehensive array of databases, in addition to the reference lists of eligible records, was searched from the dates January 2014 to February 2024 inclusive. Following the search, 10 records covering 10 separate studies were retrieved. Where samples and assessments were taken in active humanitarian crisis settings, glycemic management was consistently suboptimal. However, among individuals displaced from humanitarian crisis settings, glycemia varied. Across both groups, people within and from humanitarian crisis settings, data relating to blood pressure, lipid targets, severe hyperglycemia, or diabetic ketoacidosis were either unavailable or limited. Where data were available, this indicated that type 1 diabetes is not being adequately addressed. Collectively, data indicate that there is a pressing need for the development of a consensus guideline on and core indicators relating to youth with type 1 diabetes within and from humanitarian crisis settings, plus monitoring systems and outcome data. Data obtained could help drive advocacy and change to ensure positive outcomes for vulnerable youth with type 1 diabetes within and from humanitarian crisis settings. Unless change is made, this vulnerable population will continue to have suboptimal diabetes management, increasing their risk of complication onset and progression.